The COVID-19 pandemic continues to wreak havoc across the world as even well-developed countries have had to introduce restrictive measures to citizens and tourists alike to manage its spread. The stresses brought about by the novel coronavirus, including the economic inactivity, the inability to earn an income, and not being able to provide for family as well as physical distancing from loved ones, weaken your mental health.
I was a cargo agent, 27 years. And I get one sudden letter yesterday, man, that was devastating. When I tell you, I feel like you get stabbed in your chest. And it make you feel depressed, man.
This COVID-19 has come and really had an impact in all our lives, economy, family.
These are among the realities of the COVID-19 pandemic. It is non-discriminatory and affects children and adults. As of January 13th, Belize has recorded 11,419 confirmed cases so far and has a fatality rate of 2.43, which translates to 278 deaths, the third highest in the Caribbean. A number of doctors have lost their battle with the virus, and many more have been infected, which supports the clamor that frontline workers, who are arguably a most vulnerable group, are not impervious to the deadly disease. Director of Health Services Dr. Marvin Manzanero is a survivor after spending a week inside a COVID intensive care unit at a private hospital. The once face of the national response to the virus speaks about his bout with COVID.
I have been for more than 14 years a public servant. And not once in those 14 years have I called in sick. And even though this is my second bout in an ICU, because I had one in 2012, this time around it was different. And so now I am going into 5 weeks that I was diagnosed. I have what I call yo-yo days, and even within a day, I think you have yo-yo moments where, just like half an hour ago, just like all the energy is just sapped away from you. Out of the blue. It's not even doing physical activities. How you go from leading a response in terms of Ministry of Health, do policy development, keep on top of science, and then you get COVID-19 is a difficult situation. And when I came home after being 1 week inside a hospital, I think that's one of the reasons why I had this, and it comes at times as well, is this immense guilt.
Dr. Manzanero says that it is now about living with COVID-19 because in his experience, there is a physical, emotional, spiritual, and mental toll that comes with it. He speaks to a survival mode, which is known all too well by Ingrid Vega, who after almost 2 weeks on mechanical ventilation is now at home recovering from the virus, but not without a constant supply of oxygen. Vega lost her husband to COVID 1 day before she was intubated.
It was a big hit. I mean, I wasn't even present at my husband's funeral, Mm-hmm. My daughter would be the one telling me, what happened at the funeral. And as is, I'm not even in Facebook. I don't even go in Facebook right now because I'm not ready. I am not ready to see the funeral, to see the post of him, because I am still dedicated on recovering.
Yeah.
I know that grieving would delay my recovery. Because I'm still in recovery. It's going to be a while, because it's a day to day. Slowly, we're getting there.
Since the advent of COVID-19, there has been an increase in persons, including men, accessing mental health services. Mental health professional Amy Jex says there has been an effort to keep people engaged during these stressful times.
There have been a lot more people accessing services, and you would be surprised that it's not just people who typically would access services. With COVID, a lot more people are more open to recognizing their emotional needs. There's a lot of grief associated with COVID. It's not just anxiety, it's grieving who you are. The mental needs are not just academic. Psychosocial needs, definitely developmental needs. It's not an alternative. We do need that socialization. We do need that togetherness.
The call is for all to be socially responsible. So while vaccines are now being administered in some countries, washing your hands, wearing face masks, and practicing social distancing are among the routines that must be maintained as a norm. Reporting for News 5, I am Duane Moody.